holding conversations with various practitioners who are affiliated in our clinic and who are part of the team that are involved in assessment and treatment of children and adults. And PANS and PANDAS is one condition that we treat. So today we are going to be having a conversation with Dr. Soderbergh. He is a psychologist, a neuropsychologist, and I will let him introduce himself.
Perfect. So I'm Dr. Carney Soderberg. I'm a licensed psychologist, and I provide psychological and neuropsychological assessment, as well as consultation for individuals, families, here at Integrative Psychiatry, Austin. So I'm proud to be part of the team here.
Well, and we're lucky to have you as part of the team. So one of the things that I frequently get from parents and also other healthcare professionals is that why would neuropsychological testing be necessary? What role does it have to play in treatment planning of a child or a family who is struggling with a child who has an autoimmune illness like PANS or PANDAS?
Yes, neuropsychological testing is a very thorough and effective way to identify areas in which an individual may be strong or excelling, areas that, as well as areas that may need some additional support. In the case of school-age children, that could be in the educational environment, or at home, or in another setting. But the data that we collect through neuropsychological testing can help other folks who are working with an individual know not just what needs to be supported, but also some ideas as to what those supports should look like. So the process begins with an intake evaluation meeting, and that can be done with any number of individuals who are close to the person and have sort of detailed knowledge of the person's history and current functioning. That meeting, the purpose of it is to go through kind of a review of the history, to identify and specify the purpose of testing or the specific questions that can be answered through testing. And then give a little overview and some information regarding the process so that people feel oriented, people feel, very in touch with the idea of, why this could be helpful. And what's going to happen. In the case of adolescents and adults, often they can be included in that process so that they feel that it's really their assessment, not just something that's being provided to them.
You collect all the data, and there's clinical data that you collect, meaning that you might contact the teacher, you might contact the parent, you might contact other people that are involved in their child's care. And then once you have that, then you do the testing.
Right. So, so the data collection phase, is the next step, and that is necessarily multifaceted. We don't just want to rely on one kind of data. We look for patterns in the data. We look for trends that may help to confirm a finding. For example, there are many settings in which one type of data is relied on. So behavioral ratings, for example, they have a lot of value, but they can also be somewhat subjective. So getting ratings of a child or person's behavior from not just one setting, but across all settings in which they exist and function, can help provide an idea about how consistent particular behavioral patterns are, or how much they fluctuate. So then we can find out what's going on in each setting that might better support or possibly trigger a behavioral difficulty. So that's the value of behavioral ratings. We also use performance-based testing, and that is a standardized, normed set of measures that is administered, and then the performance is compared against individuals of the same or similar age who have taken that test during the norming process. So it does give a more objective way of quantifying someone's performance in a certain area. And those tests are all designed to tap different parts of the brain. So, different functions, attention, memory, visual spatial perception, verbal reasoning, processing efficiency, executive functioning, and the list goes on. But for children with PANS, PANDAS, we also have a particular profile that we would expect to see, and performance on performance-based standardized testing can help to confirm the existence of those weaknesses. The other piece that we use is behavioral observation and clinical interview. Observations nearly always take place in the test setting, but they can also occur in settings such as classrooms, at school, and they provide more qualitative information about not just what is difficult or easy for a child, but how that looks, and how a child or a person might express that they're finding something hard, finding something easy. So that other folks will know what to look for when they work with that person.
So in a way, it's a 360-degree kind of a view of a child's functioning.
The results are first typically communicated during a feedback meeting, usually attended by the same individuals who were at the intake. And then we return to the referral question, and we give some answers. And then we describe how the data collected helped us to arrive at those answers. So then the other piece is kind of the what to do. We look at specific recommendations that would be made that are also covered in the report.
The solution set there is vast. But if I were to ask you about just an example of what kind of things can we do for a child, for example, with PANS or PANDAS who's struggling with academics, like, are schools pretty open to giving assistance, or what can the report help with? How can that help?
So I've worked with a number of school districts in this area and others. I think what I hear from most districts is that they are able and willing to help, but often want to know specifically, why that help might be requested, and what the expected outcome might be of the support. So. And when I give feedback and when I collaborate with parents, teachers, other care providers, I'm careful to really go into detail to make sure that the reason for a recommendation, recommended support might be is best understood. There are different areas that a student with PANS or PANDAS might need help with. And so being able to focus and concentrate on classwork or direct instruction, being able to make transitions easily, being able to handle and manage, request, and accept help with stress in the classroom, managing sensory overload, because some schools can be at times sort of loud or stimulating places. To handle the specific demands of academic work in terms of reading, writing, mathematics, these are all areas that can be accommodated. Social demands, so helping the student to navigate interactions with not just other students but also adults at the school who may be have expectations for them to do different things. Children with PANS and PANDAS can be, when symptoms are severe, can be aggressive and can be quite disruptive in the school environment. So the first step is often education. So making sure that teachers and folks working with these kids know not only why this is happening, but also the function of the behavior, what purpose the behavior serves. If a child's overwhelmed or frustrated, often aggression can be, it can serve to distance something that is overwhelming. So being able to kind of remove that before or modify it in some way so that it is less overwhelming can help decrease the likelihood of that behavior occurring. So specific accommodations and instructional modifications often revolve around modifying or removing a demand.
So, just having these tools, which are very psychosocial in nature, they can be fairly important. So, thank you very much for being here, Dr. Soderbergh. I value our work together, and we are going to hopefully talk again soon, where we're going to talk about some of the psychological treatments that are available.
Fantastic. Thank you for having me.